antibacterial spectrum. Penicillin affects gram-positive and the negative cocci, positive bacilli, spirochetes, and actinomyces. Extended spectrum and broad spectrum affect also gram-negative bacilli. Resistance to penicillin may be due to lack of peptidoglycan structure, for example in mycoplasma, or more commonly due to formation of penicillinase or B-lactamase enzyme. Pharmacokinetics: after absorption, they are distributed to all tissues, low level in CSF except in meningitis because they can cross to brain if there is inflammation, excreted mainly by tubules and partly by glomeruli. Therapeutic uses: treatment of streptococcal, staphylococcal, pneumococcal, and gonococcal infection, syphilis, actinomycosis, diarrhea, meningitis. Also in typhoid fever, we give ampicillin or amoxicillin. In urinary tract infection by broad spectrum and extended spectrum penicillin. In prophylaxis of streptococcal infection in rheumatic fever by benzazine penicillin, 1.2 million units intramuscular every month until age of 20 years, and also in prophylaxis of subacute bacterial endocarditis. Toxicity of penicillin. Penicillins are among the safest antibiotics. Hypersensitivity reaction may occur, and the major cause is penicilloic acid, which reacts with protein and serves as a haptene to cause immune reaction. Allergy may be in the form of rash, itching, urticaria, angioedema, or the most serious anaphylactic shock. There is close allergy with other beta-lactam antibiotics. Diarrhea by destruction or affection of normal balance of intestinal microorganisms or intestinal flora with incomplete absorbed penicillin, especially ampicillin, and superinfection may occur on long use, and superinfection may be bacterial or fungal. Meningitis. Very high concentration intramuscular produce local pain and induration at site of injection, and intravenous preparations may produce thrombophlebitis. Acute interstitial nephritis with methicillin, carpenicillin and ticarcillin, and very large doses of penicillin G may affect platelet dysfunction and decrease platelet aggregation. If penicillin is given in very high doses or intrathecal, it may produce seizures and epilepsy.